Crash Course Anatomy. I'm your host, Sam Levy. As usual, we'll have the lovely Jennifer Reedy telling us the reproductive system today. We're starting with the male reproductive system. Jen, begin.
We have the external urethral orifice, it's right here on the outside of the penis. The prepuce is the outside skin of the tip of the penis. The glans penis is this red over here. Then the corona of the penis is the whole tip of the penis. And then the spongy, stop laughing, Sam. The spongy urethra is the pink, right here. Corpus cavernosum is the gray. Corpus spongiosum. Okay, the Cowper gland is here. The membranous urethra is Chan. Membranous urethra is here.
Yep, and above it is going to be the
prostatic urethra, and then this is the prostate gland. This is the ejaculatory duct, and then the seminal vesicle.
Hey, isn't the blue part usually the prostate gland?
No, this is the prostate gland.
Oh, there it is.
Okay, then this is the seminal vesicles is here. See that? The urinary bladder is. This is the urinary bladder, and the ductus vas deferens is this long tube. Goes. Okay, the epididymis is right here. The testes is here. The scrotum, and the seminiferous tubules is right here. These white little tubules inside of the scrotum. And now we go to the female reproductive system.
Yay!
Okay. So we have the vagina, we have the cervix is right here, we have the external os, the cervical canal, the internal os, we have the isthmus of the uterus, which is an area that crosses right over here. And then we have, on the other model, the isthmus of the fallopian tube is right over here. It's this area right here.
What area is it?
The isthmus of the fallopian tube. And then you have the uterine canal, which is right here. And then the body of the uterus is this whole area surrounding the uterus. You have the perimetrium surrounding the outside of the uterus. The endometrium, the myometrium is the middle, and then the endometrium is the inside of the uterus. So on this model you can see the body of the uterus here. You have the perimetrium, and then the myometrium, and then the endometrium. Okay, then you have your uterine fallopian tubes, which are here. These are your fallopian tubes. And you have the infundibulum, which is the entrance to the fallopian tubes. You have your fimbriae right here, these little fan-like things. And then you have your suspensory ligament, which is lateral to the ovary. This is the ovary, and this is your suspensory ligament. And then you have your ovarian ligament, which is this number 9, which is medial to the ovary. And then you have your mesovarium, which is superior to the ovary. And then you have your broad ligament, which is inferior to the ovary. You have your ureter, which is on the other model, which is this little piece right here is the ureter. You have your uterosacral ligament, which is this ligament right here, inferior to the ureter. And then you have your round ligament, which goes right here, all the way.
Is that the whole thing?
Yeah, round ligament starts here and it goes all the way around here. And then you have your, we go to back to the ovary, and you have your primordial follicle. And then you have your primary follicle right here. And then you have your secondary follicle, and then you have your tertiary follicle, which is right here, which is called the mature Graafian follicle. Okay, so then you have your germinal epithelium, which is the outside of the ovary, the surface of the ovary. You have your tunica albiginia. I don't know how to pronounce that. Albiginia, tunica albiginia, which is this, like, right on the inside, this dark pink. That's the tunica albiginia. And then the medulla of the stroma is inside of the ovary. And then you have your corpus luteum, which is right here, which produces progesterone. And then you have your corpus albicans, which is this yellow right here. And that's the female reproductive system. We're done.
Anything else?
No, we're done.
All right, thank you, Jen. And this has been
HD.
this has been another episode of Crash Course Anatomy. Though this time we're broadcasting in HD. Chan,
We're going HD.